Now, the last year has been supremely challenging for all of us with the COVID pandemic, but more so for our saviors, that's the doctors and health workers who've toiled day and night in the face of the pandemic. It's taken a toll on the doctor fraternity as well. Now, the central government stated in Parliament that 162 doctors died due to COVID in the country, but the Indian Medical Association reacted to that figure in shock, saying that the figure was much higher. It was 734 till the 3rd of February. Well, to talk more about this, we're now joined by Dr. J. Jayalal, President, Indian Medical Association, also Dr. Shekhar C. Mande, Director General, CSIR. Dr. Jayalal, first to you. Tell us about the statement that the IMA put out. You also want a high-part committee to actually look at all the data on doctors.
Yeah, we salute our doctors who have sacrificed their life to safeguard our community from the onslaught of coronavirus. In that pursuit, across the country, the modern medical doctors, they were able to come to the forefront and fight against this and not caring about their own health and their family health. On this, we have lost 739 as on date, the doctors who are very senior people who has done a human service to the country in various walks of life. Even some of them has done that home visit, some of them done the private clinics, some of them also were in the government sector. It is very unfortunate to note, it is most of the time, it is the family physicians or the general practitioners or the people who are above the age of 65 is the more onslaught of this virus. But we also shocked to see not only one doctor, even both the couples were also died due to the corona. They were very young age, 42 years they have died. We are the youngest age group we have seen is 30. Even some of the junior doctors who has lost this life. This is very, very pathetic, and in comparing with the data with the general population and the doctor community, we had nearly 10% increase in the mortality among the infected doctors, infected and other general public. The mortality rate was only 1.6 if the entire population, but it was nearly 10% for our medical fraternity. So it was a big challenge. Not only that they have lost, some of their family members have also lost, because they were the source of infection for their family members also too. So this data with their address, their age, and at which place they had died, we are submitted to the government. I'm not sure that what the government is doing with that data which was submitted by the Indian Medical Association to them.
All right, Dr. Shekhar Mande, your view on this, because it was very surprising because there was such a big disparity between what the government number was and what the IMA is claiming. And do you support this demand for a committee to look into this data and see the list of people who have been submitted by the IMA?
See, it's very difficult to comment for me because government has its own sources to collect the data, and those sources, the data would have been collated and put out in public. But if IMA has a difference in opinion, IMA has every right to represent with what they think is the correct thing. And I'm sure that government will look at it and put out the thing. But it's not for me to comment upon it.
Sure,
it's
sir.
Minister of Health and Family Welfare who will actually take a look at it and probably comment more about it.
Sure, sir. But if we talk more about, the toll this has taken on doctors and their family in the last year, such a high number of deaths, compared to the general population, do you feel that there needs to be more done? And as senior doctors, do you think there needs to be more done in terms of, giving some sort of help to junior doctors and some sort, because it's been very traumatic this last year, nurses, health workers, what they've gone through in the ICUs. Now it's, of course, much better, but let's not forget those days when it was, they were working round the clock and many people were dying.
Absolutely. I mean, the work that our doctors and the healthcare workers have done is phenomenal. The kind of work that they have done in trying to rescue the entire thing and trying to fight the battle is absolutely phenomenal. So anything for the healthcare workers and the doctors that needs to be done from public or from the public support system, it would be a welcome step. So I'm sure there could be further talks about it, and I don't see any reason why, if any more support is sought, that cannot be considered sympathetically.
All right, Dr. Jayalal, has there been any response to the IMA statement where you've given this much higher figure of 734 and made that demand for a committee?
Yes, indeed. Immediately the ministry responded to us and they said it is only the number which is quoted in the parliament is only the people who have applied for the PM insurance fund. that was that was not explicitly said by the parliament, by the minister. He never said there is still other people have died, but he has said only the 164 people have died. But still, that is a written letter which has replied to us by the ministry that we have quoted from the PM Insurance Fund. The number of people who have applied for this. That is what we have said. We have not said the total number of deaths. We also acknowledge that there's quite a lot of people have died. But my appeal to the government is, at least whether you are giving fund or not is a second criteria, but at least recognize them as the warriors of this country. Even in the Kargil war, we have not lost so much of soldiers. In the safeguarding our country and flattening the curve of the corona today, the credit goes to the healthcare workers and the modern medical doctors. And at least the government should acknowledge them as the warriors of this war and honor them. It may not be even in the money. It can be even the honor by the government will always soothe the painful hearts of the entire medical fraternity today in this country.
Right, absolutely. Thank you so much, Dr. Jayalal and Dr. Mande, for joining us on that. And yes, of course, anything that can be done for the doctors and their families who've seen us through this very, very difficult year of the pandemic. Well, now for our newsmaker on the show today to talk about the latest on the pandemic, the different variants and also the latest vaccine news, we're now joined by Dr. Prabhat Jha, epidemiologist, Director, Center for Global Health Research. Thank you so much for joining us. Now, what can you tell us about the situation in Canada first and foremost in terms of the virus and the vaccine program?
The virus is not under control in Canada still. We've had a significant second wave. The first wave was reasonably modest with less than 3% of the Canadian population getting infected. The second wave looks bigger. Only in the last 2 weeks or so is there a reduction in the cases and hospitalizations. And the vaccine introduction has been quite slow. Certainly not at the pace, for example, the UK has been able to achieve. So we still have a lot ahead to be able to get in front of this epidemic in Canada.
And what is your view on the variants that have emerged and have been identified in various parts from the UK, South Africa, Brazil? How worried are you over that, and can we expect more dangerous mutations?
My main concern is not so much for the mutations emerging here, but emerging, or in high-income countries, but emerging in places like Brazil or South Africa or India. In those settings, there's clear evidence, for example, in Brazil, that they had large levels of infection in one city, and then the infection came down, and then they had a big second wave, which very much seems to be due to the mutation. So mutations in areas where there's very little capacity to detect them, such as in India, would be a real disaster. In Canada or in the UK, despite the mutation, the overall trends for the last 2 weeks seem to be positive.
All right, sir. Now, currently, the vaccine programs are moving ahead in developed nations, even though, they're a bit slow. But there's also worry about poorer countries, developing countries that don't have enough access to vaccines.
You cannot have a global solution without having all countries share in the vaccines. The vaccines don't respect borders and they don't need passports. Let me rephrase that. You cannot have a global control without having control in every country. The virus certainly does not need a passport to cross borders. And as we've seen, you cannot control the situation even in a place like the UK without having control in all the countries that might send visitors to the UK. So we really do need a global solution. I think vaccine nationalism is emerging as a big disaster for not just the developing countries, but also for the richer countries.
And what is your opinion now of a coronavirus situation in India? Earlier, when we had spoken to you right at the start of the pandemic, you insisted that you must count the dead to know really the extent of the disease. Now, at least in India, it seems that the coronavirus situation has come under control, at least in the cities.
Well, you have to look at India in different ways. You have to look at urban India as quite distinct from rural India. So in urban India, the evidence from particularly the big cities seems to be very much that the cases and the deaths are coming down. And in a city like Mumbai, which has reasonably good certification of deaths, that confirms that the trends are generally positive. However, of the 1 crore deaths that occur in India, 7 lakh occur in the rural areas, in the villages, and at home. And therefore, the causes of death are not known. And these large parts of India, we simply do not have information that COVID is under control. We think it might be coming down along with the urban areas, but we simply don't know. We're guessing. And for many months, I've been encouraging the Registrar General of India to restart their survey, which is called the Million Death Study, which would give accurate information on what's happening in rural India. Right now, we don't know. We're simply guessing.
Now, there are various theories about, why the numbers in India have come down. There's some talk of local herd immunity, maybe in the cities. There's also talk of cross immunity because we have so many infections every year. What is your view on this?
The truth is we do not currently know. The reason that the numbers have come down might be several. First of all, in the big cities, it is true that upwards of 50-60% of people might have already been infected. Secondly, it might be that those in those cities that have not been infected might have some biologic immunity for reasons that we do not know yet. But you have to be really careful here. This virus doesn't simply go up and come down. It has different waves. And as we've seen in Delhi, there was a big wave of cases and deaths in June, but a second wave in September. And other settings also show multiple waves. And it might well be that when the hot months come and more people crowd indoors, the infection and the death rates might again go up. So you cannot say that India has turned the corner completely. The epidemic varies by different localities, and the reasons for this are not known. It's a dangerous idea, however, to think about ideas of herd immunity simply because we don't understand it. And herd immunity is more wishful thinking than science currently.
All right, this much touted, herd immunity that we've been hearing from the beginning of this pandemic. But what about the issue of long COVID and post-COVID impact? Do you think we know everything about that yet? There are so many people who have, prolonged illnesses, so many people who suffer from various problems after having recovered from COVID.
The virus continues to surprise us, and it has, obviously, it's going to evolve and mutate as all viruses do, depending on how many people are infected, and even the introduction of vaccines will also lead to changes in the virus. The consequences of the virus in different populations remain largely unknown, and what is needed is very robust epidemiological studies that are done continuously, and very importantly, are open and available for public scrutiny. Lots of skepticism can arise when data are gathered by governments and not transparent or not having undergone scientific scrutiny by others. So this idea that the government can release a study and say, trust us, well, people won't until the details are available of all of these studies. So I think both things are needed. You need more studies and you need more transparency and openness in what those numbers show. That in turn will build public confidence to understand the virus and will also reduce hesitancy about vaccines.
And speaking of vaccines, what is your view of the vaccines so far that have been made available? The good news is that the Russia vaccine has a very good efficacy. Earlier there were misgivings, there wasn't enough data available, and now this is a vaccine that we're expecting here in India. So your view on that?
I think people should listen carefully to what scientists and not politicians say about the vaccines. I personally have great confidence in the AstraZeneca and the Russian Sputnik vaccines. Why? Well, they have both undergone quite a high level of scientific scrutiny and publication and availability of data. By contrast, the Indian Covaxin does not have the comparable scientific scrutiny till now. Now, if this changes, then my opinion about the Covaxin might also change as a scientist. But the AstraZeneca, the Russian Sputnik vaccine, I would certainly take and give to family members. As you said, for logistic reasons, the Pfizer and Moderna vaccines are not practicable for the whole of India. But these other vaccines, the AstraZeneca and the Sputnik, are widely practicable.
Thank you so much, Dr. Prabhat Jha, for speaking to us here on the show. Time for us to slip into a short break. On the other side, our viewer question segment. Stay with us. Welcome back. It's time now for a viewer question segment, and we still have with us Dr. Shekhar C. Mande to take those questions. Thank you, sir, for staying on with us. Let's just listen into the first question.
Hi, my name is Kena Lalit. I'm from Kulu. Is going to school safe, especially if you have grandparents at home?
Right, sir.
Thank you very much for the question. Indeed, going to school is safe if you follow all the precautions that are necessary with it. Make sure that the children and the teachers, they must wear masks. If as far as possible, remain in open ventilated areas, maintain hand hygiene, and as far as possible, maintain distance from people. If you follow all these precautions, masks alone actually reduce the risk of contracting COVID to a large extent. So your concerns are genuine, but please follow all the precautions and then you would be hopefully safe.
All right, let's listen into the next question.
I'm Arjun Nayak from Delhi, and my question is that is it advisable for people who have heart problems to take on the vaccine? Is it safe for our elderly?
Right, he's probably concerned about the elderly in his family. Is it safe for people with heart problems?
Okay, thank you so much for your question, Beta. What you must do is go strictly by doctor's advice. Your doctor will tell you to whom the vaccine is safe to be given, whom not. And in fact, the elderly people, that is the people above age of 50 and with comorbidities, are among the priority people to be vaccinated. But you must go strictly by the doctor's advice, and the doctors will give you a correct advice on that particular day, whom to be vaccine can be given, whom it cannot be given.
All right. Well, thank you so much, Dr. Mande, for answering those questions for us.